A very important question that we have, once a patient gets transplanted, he's allowed to travel compared to patients that are on dialysis. So what are the things that you should do prior to traveling once you get a kidney transplantation? So there are a few things. Number one, you should inform your doctor of any travels abroad few months in advance. This is because depending on where you travel to, there are certain precautions and even vaccines that may be necessary. Remember that no live vaccines are allowed in patients who got a kidney transplant because of their weakened immune system. So how can you find out? So the easiest way is to consult with a infectious disease doctor in order to know exactly what type of vaccines that you need. You can also double check on the CDC website that I'm showing you here, and this will tell you, according to your travel destinations, which are the precautions that you need to take and also which are the particular vaccines that you may be necessary to do. What's the checkup trip list that you should do prior to going? Number one, have enough transplant medications. Remember to put in two different spots, not only one bag, in order for you to have a backup medication when you go to a travel. Always have more than you need in case something happens. Always ask your treating physician to prescribe you an antibiotic that may protect you against traveler's diarrhea. This is when you may have a diarrhea that's very severe or it has blood in the stools, and this may require an antibiotic, and you want to treat this very rapidly. Bring acetaminophen or Tylenol for any pain or fevers. Have a contact information of a major medical center close to the area that you travel, and always inform your physician of when you're going so that they can be aware of that. Last of all, bring a hat, sunscreen of at least 50 SPF, an insect repellent, and a hand sanitizer. This can be very helpful for you to just keep your overall hygiene and avoid getting infected through contact of infected patients. What are recommendations during your trip in order to avoid any problems? So first of all, stay hydrated and only drink from bottled waters, okay? Avoid eating raw vegetables, especially in certain settings where you don't know where they're coming from and how well they have been washed. Third, you always have to wash your hands very often, especially before eating or after touching surfaces that other people have touched, such as handles. If soap and water are not available, clean hands with a hand sanitizer. When changing time zones, take the medication according to time between doses rather than time of the day. And this is very important, so keep track of the time that you've taken your medication and adjust accordingly when you're on a trip. Use alarm clocks and other reminders in order to not forget to take your medication.